I'm Dr. Gracias. I'm a family doctor. I'm excited to be here. I'll be part of the reform program and then taking on some patients as well to transform health in Calgary. So it's a very interesting path. Like, I feel like it's quite layered, you know, it's part of my life experiences that kind of brought me to where I want to be right now in terms of working at SABI. I've realized that healthcare has been quite reactive as opposed to being proactive, and having the ability and the time and the resources to make those changes for patients' health is going to be really important and has been important for me in the last few years, and SABI Health is going to help me achieve those goals by truly transforming people's lives. So health and wellness, I feel like those definitions do change based on where people are in their lifespan, right? So, you know, like graduating from university, having your first child, retiring, becoming a grandparent, different goals, different health goals, and different ways to get to those health goals. I think at the core of all of that would be wellness, and what does wellness mean to you in each of those health stages, right? Now that could be, you know, what's your relationship with stress management, what's your relationship with sleep, with alcohol, with exercise, and most importantly, what's your relationship with yourself? And I think when you focus on wellness, your health has to improve. I think when you truly boil down everything, my favorite word in the English language would be why. You figure out the whys of certain behaviors. You know, for example, why did I start smoking? Why is my health taking a turn for the worst? Why is my sleep so poor? Why do I not exercise? On the flip side, why do I exercise, and why do I like to eat healthy? Understanding the whys of a certain behavior can help you put more focus on the intention of that behavior, which can then help you either continue on that good path or make a change of that reflexive behavior to improve your health. Life is very busy, as it is for everybody, right? And depending on, again, which stage of life you're in, you have different levels of stress and different levels of busyness, we'll say. But if I focus on the physical health, the mental health, the spiritual health, I think it has to come down to, again, what's that relationship I have with myself? You know, just like when you first get onto an airplane and they tell you put your own mask on first before you assist others, I think focusing on yourself and focusing on your relationship with yourself is your number one goal. And then the diet and exercise routine that anybody can research, or ChatGPT, I guess, has to fall into place, because you're doing something for yourself. When you're able to put yourself first is when you can truly be there for your family, your friends, your colleagues, your patients. So I think focusing on my own health then allows me to then deal with wellness for me and also wellness for everybody else as well. So what first inspired me to pursue medicine, become a medical doctor? I think that has to do with, I guess, just the exposure of going to see my own family doctor, who I had a great relationship with. And he was someone that saw me from a medical standpoint, from a personal standpoint, from an emotional standpoint as well. And being able to know that there was someone there who was not family, who was somebody who was very objective, but who knew me in these different facets of life, is what pushed me to go into medicine, where you can truly make a difference in someone's life, and it's very impactful. So was there a moment or change that impacted how I deliver or thought about healthcare? Yeah, I think there was a time, probably in the last, let's say, 9 to 12 months, where after becoming a parent and realizing how much your past can impact you in the present and in the future, helped me go down my own path of understanding who I was, and then putting on my medical lens, or my scientific lens, we'll say, helped me understand our past impacts our present and our future. And that is very, very complex, and it hits us from our diet, our exercise, our sleep, and again, our relationship with ourselves. So that's what prompted me to go down this path of how can I be less reactive to a patient's health and more proactive? Yeah, so what's one myth about health and wellness I wish that people understood a bit better? I think with the way social media is right now, and there's a lot of information, and it truly is information overload, it can be very overwhelming for a variety of patients. It doesn't matter what stage of life you're in. And I think having a patient understand that if we try to keep things as simple as possible, good relationships with ourselves, good relationships with others, good diet, quick and easy exercise routine, that's the best stepping stone to improve your health. Evidence-based medicine is very scientific, and there are great protocols that come out of that. But one of the cornerstones of family medicine in Canada is practiced as being patient-centered or patient-first. So having that conversation with your patient, understanding the whys of why they don't want to do something or the whys of why they want to do something is extremely important to help blend the evidence-based care and patient-centered care. I hope that people feel empowered. I hope that people feel knowledgeable. And I hope that people feel that I am truly on their side. After working out in the community in Alberta and also in rural Saskatchewan for a number of years as well, I think just knowing that there's support for patients from not only a medical doctor, but also from a nurse practitioner, from a dietitian, from a naturopath, from a physical therapist, having those tools to hit every aspect of someone's quality of life is extremely important to truly improve their overall health. And what SABI does differently is continuity of care. There's not a one-time visit and I'll see you again in a year. It's multiple visits throughout the year, which again, give patients the ability to know they have support and also gives them like a lifeline, really. Yeah.